So for my presentation today, I would like to talk to you about improving healthcare for underserved communities. My name is Valentine Mukundene. I'm originally from Rwanda. I'm married with 2 beautiful kids. And that's my daughter over there at the Black Lives Matter protesting, because we believe like health is in different domains, just not physical and mental. So when I came to America as a refugee, I feel like my experience in healthcare system has been disappointing. I feel like my culture hasn't been well considered and respected by a big number of healthcare professionals. And I share this experience with many people from minority communities because that's where I hear from them. It's well known that there is racial and ethnic health disparities in America. It has well been documented, and actually COVID-19 is a good example showing the health disparities among underserved communities in America. I want to talk about how healthcare disregard culture. It has always been this one-size-fits-all practice. However, America is so diverse, and patients' diversity needs to be considered by healthcare professionals when they take care of their patient. No one can learn about cultural competency in one sitting. It has to be ongoing effort because different patients have different needs and different cultures. Therefore, healthcare professionals need to take their time learning about each culture one by one to make sure they understand. So what should be done for everybody to be treated fairly and be happy with their health, but also for our society to be more healthier physically and mentally, and at the end for all of us to have a comprehensive healthcare system that works for everybody. The solution number one, healthcare professionals need to understand the cause of health disparities. In 2018, there was a study showing that among 400 hospitals in America, Black patients were treated poorly compared to white patients. And these were people with similar care, health insurance, similar health conditions. So what is health care inequality? This is when one group of people is treated poorly compared to other one. So pretty much the higher your income is, the better health care system you receive compared to other group. So going back, talking about cultural competency for healthcare professionals, cultural competency means the ability for providers and organizations to deliver healthcare services that meets social, cultural, and linguistic needs of their patient to make sure everybody is well respected and served well. Solution number 2, healthcare professionals need to take their time when talking to their patients with full attention instead of being in a hurry, but have actual conversations. Instead of having question and answers, but have actual conversations with their patient to make sure they understand. Solution number 3, healthcare professionals should understand that there are different cultures. For example, in my culture, unmarried people, especially women, do not feel comfortable to talk about birth control methods. So healthcare professionals need to find an appropriate way of bringing this conversation in, at the same time make patient comfortable. Solution number 4, healthcare professionals should know the best communication method for each patient. Is it communicating by email, by text messages, by phone calls? What is appropriate for each one and what works better? Of course, we can only achieve this if we understand each other's language, and that's why it's so crucial to provide interpretation when possible, especially like for immigrants. Most of the time, English is not our first language, and so that's why we struggle sometimes to communicate. The thing is, we don't see things the way we are. We always see things the way we are. And that's why most of the time healthcare professionals are having hard time to believe that there is a problem. However, they should understand that there is a problem, and they should also be willing to implement special approaches needed for each patient. Of course, patients should also have a say and a role in the improvement. They can do so by participating in activities like focus groups to make sure they have a voice, they advocate for themselves and for their whole communities at large. We need to understand that underserved communities have different needs. Some of them do not have health insurance. Others, they don't have even physical address to receive their emails or their mails. Others have language barriers. So we need to take each problem unique. But at the bottom, we need to understand and ask patients how they want to be treated, so that patients have a role in their health care and they are involved in decision making so that they can feel comfortable with the treatment they are receiving. So how do we close the cultural gap in healthcare? We can do that by avoiding stereotypes and avoiding treating everybody in one size. But we can also have a diverse healthcare system that represents different youth population. The other solution, healthcare professionals need to listen to community leaders, because this shows that these communities are well respected, but it also helps to build trust between patients and healthcare providers. So as my conclusion, let's do something all together before we all sink. Because if there is a hole on one side of the boat, no matter which side it is, the health care for everybody is going to be jeopardized, and we are all going to sink together, and this will be a big issue for all of us. Thank you.